Welcome back to the Deep Dive. Today, we are strapping in for a really critical mission. We're navigating the complex, and let's be honest, often deliberately confusing world of healthcare choices.
That's right. We've got a whole stack of sources here centered on an emerging alternative model health sharing.
And we're looking specifically at the operational details from a group called Sharewell. The goal here is to give you the clearest possible picture of how this alternative system actually works and, maybe who it's really built for.
Exactly. For you, the learner, our mission today is really to cut through all that noise. We need to define what separates traditional regulated insurance from this community cost-sharing model.
Where do the savings actually come from?
And how does the flexibility work in practice? And of course, the biggest question we always get, how are pre-existing conditions handled in an environment that isn't insurance?
Okay, let's unpack that right at the start because I think that's the fundamental distinction. The material is crystal clear on this. HealthShare is not insurance, and this is intentional.
Completely intentional. It's a community-driven model that, by design, exists outside the standard government regulatory framework.
But if it's not regulated insurance, what keeps the community honest? I mean, what legal recourse do members have?
That's the essential question, right? Because when you hear not regulated, you immediately think risky.
Exactly.
Well, think of their member guidelines less like fine print and more like a legally binding handshake.
Yeah.
They're enforceable through state contract law.
So you have a contract.
You have a contract that is just as binding as any insurance policy, and the material suggests this often gives you similar legal protections, but, and this is a huge benefit, without all the bureaucratic delays you see with the huge carriers.
Okay, that makes sense. So let's talk about how the money moves. We're not paying a premium, we're paying a monthly contribution.
Exactly. And that contribution is collected, sort of like a community pool, to collectively cover eligible medical bills.
The big stuff.
The big stuff, right. Hospitalizations, major illnesses, surgeries. But the real genius here is how that money gets spent.
Okay, tell us about that mechanism.
What's fascinating is that when those funds are used, they're almost always used to pay providers with deeply discounted cash rates.
The self-pay price.
Precisely. Hospitals have this astronomical sticker price, the billed rate, but then they have a much lower cash rate for someone paying out of pocket. HealthShare members, by paying in cash from the community funds, get to leverage that massive price difference.
So you're not just saving on the monthly cost. When you actually need care, the price of that care is automatically lower.
Yes, and that is directly linked to freedom of choice. Traditional insurance locks you into networks to get their rates. Here, members don't have those restrictions. They can go to any provider anywhere, out of state, specialists, even abroad.
Okay, but let's tackle the risk perception. The sources mention this idea that insurance is a guarantee. People worry that a community pool might just run out or decide not to pay a huge bill.
And that's a critical point, but the sources really challenge that whole premise that insurance is a guarantee. I mean, look at the data. We found specifics pointing out that big insurers deny claims all the time.
Like United Healthcare.
Right. In 2024, they rejected about 1 in 3 claims, often just saying it was not medically necessary. That's a huge crack in the so-called guarantee.
So the HealthShare is trading that theoretical regulatory promise for transparency and a track record.
Exactly. And this isn't some new fad. Over 2.4 million Americans are in health shares. Since 1993, these communities have shared over $30 billion.
Wow.
And the satisfaction rate is what's really telling. 98% member satisfaction nationally. Compare that to traditional insurance plans, which are down around 56%.
That really does set the stage for the financial reality. A 30 to 60% monthly saving is, that's thousands of dollars a year for a family.
It is, and a big part of that is you're not forced to pay for coverage mandated by the ACA that might not align with your personal needs. The core strategy is you pay a lower monthly contribution, and then you get the power of those huge self-pay discounts when you need care.
And those discounts are significant.
The sources say 40 to 80% off the billed rates. It's staggering.
Okay, let's dig into the numbers, because the case study in the sources, Jane versus Jillian, really makes this real. Jane is the Sharewell member with a $1,500 unshared amount, her out-of-pocket max. Jillian has a traditional plan, $5,000 deductible.
Right, and they both need major care surgery, imaging, some recovery services like acupuncture and chiro follow-ups. The total billed cost with no coverage was $26,800.
Okay, moment of truth. Jillian, with her traditional plan, she has to hit her $5,000 deductible, pay copays, co-insurance. Her total out-of-pocket ended up being $10,250.
Now, Jane, because the shared funds leverage self-pay pricing, the total actual cost of her care dropped dramatically. Her only responsibility was her unshared amount,
Which was how much?
$1,500.
Wait, let's just stop there. $1,500 versus over $10,000. The insight here is that Jillian's high monthly premium didn't protect her from that huge bill at all. Jane's model actually protected her far more effectively.
And it's not just for catastrophes. The sources also compared annual wellness costs.
Right, for things like gym memberships, labs, holistic care.
When you factor everything in, Jane saved $4,500 a year compared to Jillian. That's real money in her pocket.
This also gets to another point of flexibility, ShareWell's support for, well, for a more comprehensive view of health.
Absolutely. Because they're not bound by those strict regulatory definitions of medically necessary, they have guidelines that actually address alternative practices.
Likewise.
They have defined allowances for holistic care, doulas, midwives, home births, even some alternative international cancer treatments.
So you can choose the provider you actually trust, not just who's on some approved list.
And to tie this all together, for those major procedures, the sources highlight a fantastic benefit. ShareWell provides prepaid medical cards.
Meaning the bill is paid before you even go in for the surgery.
For many surgeries and hospital stays, yes. Imagine heading into a difficult procedure knowing the financial part is already settled. The peace of mind must be incredible.
Okay, let's move to the part that causes the most skepticism. Pre-existing conditions. Pre-X. This is where the community has to protect itself, right?
Exactly. This is how the monthly costs can stay low. They have to protect the shared pool from known high-cost events. The definition is really specific. A pre-X is any illness or injury where you were examined, took medication, had symptoms, or got treatment within 24 months before you joined.
So if I got a prescription for asthma last year, that's clearly in the pre-X window for that specific condition.
That's the mechanism. But there are some important exceptions. For something really serious like cancer, the look-back period is longer, 36 months. But, and this is surprising, they're more lenient on common chronic conditions. Things like high blood pressure, high cholesterol, thyroid issues, even type 2 diabetes. Those are not considered pre-existing unless you were actually hospitalized for them in the last year.
The sources had a brilliant analogy for this. The pre-existing crack in a house's foundation.
It's the perfect way to think about it. Imagine joining a neighborhood co-op that helps with unexpected home repairs.
A tree falls on your garage, a roof starts leaking, the community pitches in.
Right. But if your inspector found a big crack in the foundation before you join, the community's going to say, look, for the first year, you need to handle that specific known problem yourself.
That makes the practical limitations so clear. Expenses for that pre-existing condition, the crack, are not eligible for sharing during that first membership year.
But, and this is the key, it's not a permanent exclusion. Those conditions become eligible for sharing starting in your second year.
And even in that first year, you still get the benefit of the self-pay pricing.
You do. We saw that example with the unshared cyst removal. The procedure was pre-X, so community funds couldn't be used in year one. But because they got the cash price, the family still saved $16,700 compared to what they would have paid on a traditional plan.
That is the real insight. The overall model can still save you a ton of money, even with a pre-X condition.
And quickly, on maternity. It's a planned event, so there's a waiting period. Conception has to happen at least 30 days after you join for the expenses to be shareable.
Which makes sense.
But they incentivize good behavior. You can have a baby with sharing for as little as $1,500 out of pocket, and if you manage costs well, they give you 6 months of free diapers.
That's a great community perk. Okay, so let's get into the mechanism that ensures all this fairness, the determination process.
It sounds like jargon, but it's just the formal evaluation of a sharing request against the member guidelines.
Basically, the community auditing the expense.
Exactly.
Okay.
Is this a new, unexpected, eligible need that fits the rules? To figure that out, especially for new members, they need to see your medical history.
So in the first year, for anything that's not an emergency, they need your full clinical records for the past 2 years.
They do. Visit notes, diagnoses, medication history. They have to check for that 24-month pre-existing limitation. And this is where the scrutiny is highest.
But that changes over time, right?
Yep.
There's an earned trust element.
It changes dramatically. In your second year, they typically only request records if the anticipated costs are over $30,000.
That's a big jump.
A huge jump. Then, by year 3 and beyond, that threshold goes up again to $60,000. The system is designed to protect the community, but also to recognize long-term loyal members.
So when we boil this all down, what does it mean for the learner?
I think it means the health share model is a purposeful trade-off. You're trading the regulatory guarantee of insurance for community flexibility, for transparency, and for really dramatic cost savings.
And it completely shifts your focus. The old system makes you worry about, is my claim covered?
Right. Whereas this new system with self-pay pricing makes you ask, what will this care actually cost? And how will my community help me share that burden? It's a move toward empowerment.
Absolutely. The source materials have this powerful line. If you think wellness is expensive, try sickness.
And that preventive health is more affordable than sick care.
It really is. So the final thought for you to mull over is this. When you're freed from a high monthly premium and you're empowered by self-pay pricing, you're essentially given thousands of dollars back. How does that freedom encourage you to invest in your own proactive wellness right now? That's something to think about until our next deep dive. Welcome back to the Deep Dive. Today, we are strapping in for a really critical mission. We're navigating the complex, and let's be honest, often deliberately confusing world of healthcare choices.
That's right. We've got a whole